My name is Karen Asardi, and I'm training director at the EMDR Education and Training Center. If you are a therapist already trained in EMDR therapy, you know how powerful it can be and how complex it can get. And we've designed this training to help you to answer questions, clear up confusions, expand your skills, and allow you to practice with confidence. So I just want to spend just a couple minutes to break down what we'll be reviewing in the training. We're going to start with a foundation, kind of EMDR Theory 101 to get everyone up to speed and on the same page. So we're going to be talking about the finer points and importance of the AIP model, really breaking down and making sure everyone understands maladaptive memory networks and how those impact treatment planning and phase 1 history taking. We're going to look at the 3-pronged protocol for treatment planning and EMDR therapy, and then all the while talk about dual attention and synthesis because those are the mechanisms by which EMDR reprocessing is effective. After we've kind of set the level playing field for this, we're going to take a look at phase 1. So we're going to break down all of the phases. We're going to spend quite a bit of time on phase 1 and phase 4 because those are the larger sticking points for a lot of people, but we'll definitely cover all of them. But I like to break down history taking as a puzzle, right? So we are trying to figure out all the pieces of our client's puzzle in phase 1. So looking at their clinical goals, their resources, any symptoms and triggers they have, what coping skills they come in with, as well as what dissociation they are dealing with. What are the dissociative defensive practices that they're struggling with on a daily basis in and out of session? We'll be looking at their past experiences, big T and little t traumas, assessing for attachment, as well as looking at what's going well. Again, who are their allies and what are their resources in life? What adaptives do they have? Because a lot of this is not just going to inform our treatment plan, but also what we do in phase 2 preparation. And then while we're looking at history taking, I love coming up with fun little rules and guides or useful rules and guides. So we're going to be introducing and integrating the 7 individual rules of history taking. So moving on to preparation, I like thinking of preparation phase as basics and then more advanced. So basics are the universal phase 2 activities that we pretty much do with all of our EMDR clients. The log, alliance, teach them the train metaphor and the stop signal, talk about informed consent for EMDR therapy, teach and practice BLS, and teach the container and complex. So we'll definitely go through those. And then we'll talk about some more of the fine tuning, maybe more advanced or specified unique phase 2 activities. And these are elements that we don't necessarily do with all of our clients, but those clients who have specific needs and challenges. And these tend to fall into 3 categories. We've got resourcing activities, micro-resourcing RDI, for example, affect tolerance practices, and then grounding and presentification. And these can run the gamut from being very EMDR specific to multimodal. After we've looked at preparation phase, we're going to take a look at reprocessing, beginning with phase 3, assessment of a target. So we're going to talk about not just how to go through the steps in order, but developing good habits, troubleshooting stuck points, and then looking at what's the point? Why are we doing phase 3? What are the main purposes? As well as what are some appropriate selection criteria for NCs, PCs, SUDs, and VOCs. So we're going to break that down and really help you streamline your phase 3 so that it could be something that is much more comfortable for both you and your clients and consequently doesn't take forever. Moving on, we're going to do a deep dive into phase 4 desensitization and spend quite a bit of time here. So we're going to talk about standard phrasing and scripting. We're going to break down your role, how to track change during reprocessing, and how to support the client when they're in not just stuck points, but in really problematic or heavy material. We're going to break down when and how to return to target, and actually when, why, and how to return to target. And then look at some decision points for what to do when new material comes up or other maybe blocking beliefs come up during phase 4. And then this is a big bucket that we're going to look at, the causes and solutions to ineffective reprocessing, one of which is everyone's favorite, mine included, interweave. So we're going to break down and kind of demystify interweaves and give you a formula, actually a 3-step formula for recognizing why you're going to do an interweave at this point, and then how to design the quote unquote, as near perfect as you can get interweave to help your client. And then we will round out the training with looking at the remaining phases 5, 6, 7, and 8 from installation all the way through to reevaluation. And we'll look at reevaluation on both a macro treatment planning level as well as micro reevaluating the work that you did last session. So that is our 8-phase refresher in a nutshell. During the training, we'll be using tons of clinical examples, video demonstrations woven throughout. We'll be looking at reprocessing transcripts and giving you a bundle of downloadable client forms that you can use in your own clinical practices. This is a 2-day training. It's actually a day and a half. So on Friday, December 5th, working on Pacific time zone from 8:30 to 5:30 p.m. and then Saturday morning from 8:30 to, this should actually say 12:30, just to be clear, it's not 2:30, it's 12:30 p.m. PST, so we'll do a half day Saturday morning. It's live on Zoom. So please visit our website to register, reach out if you have any questions, and we look forward to helping you continue evolving your practice with clarity and purpose. Thanks so much.